Hi, my name is Kkubeja, and I'm doing a neurologic assessment today. My partner is my coworker, Stacy.
Hello.
First part of neurologic assessment, you talk to the patient, you get to know them, see how they're answering questions, if they are appropriate. Stacy's alert and she's oriented ×3, and she answers all questions appropriately. Next, we're going to go over the cranial nerve exam. And the first one that we're going to assess is the first cranial nerve. Okay, Stacy, would you please close your eyes? Tell me what this smells like.
Alcohol.
All right, so she passed. The first one was smell, and we had her smell an alcohol pad. Next, we have vision. Stacy, do you wear glasses?
Yes.
Are you nearsighted or farsighted?
I believe I am, I don't know.
20/20 is normal, but Stacy wears glasses. So that's her vision, but she can see me and she can see from far away, but she's just not that far away. She can't see. Okay, next I'll have her do the third cranial nerve, which is oculomotor, and we're doing sensory and motor and primary motor. So you're just assessing eyeball movement. So I'll have you do the follow my finger. We'll go up, across, down, and up. And she passed that all right. And the cranial nerve 4 is actually for the trochlear, and that also has to do with downward and lateral movement. So if you want to see it again, she can put her eyes down and laterally. Good job. Okay, cranial nerve 5 is trigeminal, and it's chewing. And actually, Stacy has candy in her mouth right now, and she is chewing just fine. And it's actually face and mouth touch and pain. So, I'm going to be using a Q-tip, and we're breaking off part of it. So part is cotton tipped, and the other part is not. So, we'll have Stacy close her eyes and tell me if she's feeling dull or sharp. Or dull or soft.
Oh, dull or sharp?
Dull or sharp.
That's dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, she passed. So the next one is cranial nerve 6, and it's the abducens. And this is when you turn eyes laterally, which we actually already covered in 3 and 4. So we know that Stacy can do that. And it also has to do with awareness of the body, which she passed that with the dull and sharp test. Cranial nerve 7 is the facial nerve, and it controls facial expressions. So we're going to have Stacy smile, frown, raise your eyebrows. All right, so she does good with that. And it also has to do with secretion of tears and saliva, which she produces those just fine. Cranial nerve 8 is the I don't know how to say this one, but the auditory. And this is for sensory, and it's hearing, which she seems to be hearing me okay. She's answering questions. She doesn't seem to be confused about what I'm saying. So she passed that one fine. Cranial nerve 8 is the glossopharyngeal, and this is for taste. So I'm going to have Stacy close her eyes, and I'm going to give her something to put in her mouth. Can't open it. All right, so this is what we're going to give her, and just tell me how it tastes. Okay, open your mouth. What does it taste like?
It's sweet. It tastes like peppermint.
All right, so she passed that one. Next one is cranial nerve 10. And this is the vagus nerve, which we're not going to be assessing, but this is like you would ditch stim someone, and it has to do with the digestive organs. So Stacy is fine in that area also. Cranial nerve 11 is the spinal accessory, and that one is when you would put both hands on Stacy's shoulders and have her shrug. So I'll have you shrug. All right, and she does that evenly, and it also controls swallowing. Lastly, we'll do the hypoglossal nerve, and this is when you just have her stick her tongue out. You're looking to see if the tongue is midline, which it was. All right, so Stacy passed the neuro exam. Thank you very much.